Right, listen, thyroid questions look complicated, but on step 1, they follow very predictable patterns. If you understand 3 things, you can solve most questions. Physiology lab patterns, disease buzzwords. Let's break it down simply. 1. Thyroid physiology. Thyroid produces T4 that acts as a prohormone, T3 is an active hormone. Conversion. T4 is converted to T3 via 5' deiodinase. Important inhibitors. 1. PTU, propylthiouracil. 2. Propranolol. 3. Glucocorticoids. 4. Amiodarone, meaning they lead to less active T3. Thyroid hormone function. Main role is to increase metabolism. Mechanism. T3 increases Na/Ka TPASE activity. That leads to increased oxygen use, which results in increased heat production. Think, thyroid equals metabolic accelerator. Now let's talk about the abnormalities. 1. Hyperthyroidism. It means too much thyroid hormone. Metabolism goes too fast. Symptoms: weight loss, heat intolerance, sweating, tremor, anxiety, tachycardia, hyperreflexia. Think, body running too fast. 2. Graves' disease, most important. Number 1 cause of hyperthyroidism. Mechanism: TSH receptor antibodies leads to continuous thyroid stimulation, which in turn leads to increased T3/T4. Unique findings: diffuse goiter, exophthalmos, bulging eyes, pretibial myxedema. Exam clue: hyperthyroid plus eye signs equals Graves. 3. Thyroid storm, severe hyperthyroidism. Symptoms: fever, extreme tachycardia, agitation/delirium. Treatment order: very testable. 1 to beta blocker, 2 to PTU, 3 to iodine, 4 to steroids. Mnemonic: block to stop to block to calm. 4. Hypothyroidism. So it is basically too little thyroid hormone. Metabolism slows down, leads to hypothyroidism. Symptoms: weight gain, cold intolerance, fatigue, constipation, bradycardia, dry skin, slow reflexes. Think, body running too slow. 5. Hashimoto thyroiditis. It is number 1 cause of hypothyroidism. Mechanism: autoimmune destruction of thyroid. Antibodies: anti-TPO, anti-thyroglobulin. Histology clue: Hürthle cells. Important risk: increased risk of thyroid lymphoma. Thyroid lab patterns: very high yield. Primary hyperthyroidism. TSH decreased, T3/T4 increased. Primary hypothyroidism. TSH increased, T3/T4 decreased. Secondary hypothyroidism. Pituitary. TSH decreased, T3/T4 decreased. Key rule: TSH is the most sensitive test. Thyroid nodule algorithm. Step 1. Check TSH. TSH decreased, do radioactive iodine scan. TSH normal or increased, do fine needle aspiration biopsy. This algorithm shows up a lot on exams. Thyroid cancers, big 4. Papillary, most common. Radiation exposure, lymphatic spread. Buzzwords: orphan antinuclei, Samoma bodies, follicular spread through blood, common metastasis, bone, medullary, from C cells, produces calcitonin, associated with MEN2 syndrome, anaplastic, very aggressive, elderly patients, poor prognosis. Thyroid drugs: methimazole, blocks thyroid peroxidase, leads to decreased hormone synthesis. PTU, propylthiouracil, blocks thyroid peroxidase, blocks T4 to T3 conversion. Radioactive iodine, destroys thyroid tissue. Side effect: hypothyroidism. Rapid review: hyperthyroid plus eye signs leads to Graves. Painful thyroid leads to subacute thyroiditis. Hypothyroid plus antibodies leads to Hashimoto. Radiation history plus thyroid cancer leads to papillary carcinoma. Calcitonin elevation leads to medullary carcinoma. Thyroid questions are actually pattern recognition. If you remember mechanisms, lab patterns, buzzwords, you can solve almost any thyroid question on step 1.